You heard about ABA therapy. Some people say it changed my child's life. Others say it was harmful, and now you're left with the question no one wants to seem to answer clearly. Should we even try it? Let's break that down honestly and without the jargon that comes with it. ABA stands for Applied Behavior Analysis, and at its core, it's a framework for helping kids build meaningful skills like communication, play, emotional regulation through repetition, reinforcement, and real-world practice. But that's just the what. What really matters here, the issue here is how. What really matters is how, and that's where differences start to show. ABA is not a one-size-fits-all. It depends on the therapist delivering it, the setting, the approach, the goals, and that's why you hear such different stories from people. So I want to talk honestly about both sides. ABA, when it's done well by a thoughtful, responsive provider, here's what that can offer. It can offer structure and clarity for kids who thrive on routine, progress tracking so that you can see what's actually changing, and support for big areas like communication, self-help, social skills, and behavior, and parent coaching, of course, so that you're not left out guessing what to do between these ABA sessions. It's flexible. It can be adapted to your home, your values, and your child's strengths. And for many families, it leads to real measurable growth and less stress in day-to-day life. But I don't just want to talk about the positives of ABA. Let's be honest about the downsides as well. ABA can feel rigid, especially when it focuses too much on compliance or not enough focus on communication. And some programs may push too many hours without considering your child's tolerance or your family's capability to take on this chunk of hours. And I just want to be upfront and say not all ABA providers are the same. Some have high turnover, undertrained staff, or outdated methods. They get a bad rap, and they can leave families frustrated or feeling worse, like it made things worse, or they're not heard. But there's also the emotional side. Some autistic adults say their experiences with ABA made them feel like they had to mask who they were just to be accepted, and that's what ABA was about. It's something we need to listen to for sure, and we need to learn from it. ABA should never be about normalizing your child. It should be about understanding them, meeting them where they are, supporting them, helping them thrive as they are. It should be about helping them, not changing them. So, should you try ABA? Question I get a lot of times from parents is the best advice I can give. Forget the label for a second and ask these questions of anybody who's going to be working with your child. Who will be working with my child? What level of education do they have? What will they be working on? And why? How will I be involved? And how will I know if it's helping? All of those questions need to be answered by any provider. But good ABA isn't about control. It's about collaboration. It's about using behavioral science with empathy and in partnership with your family. It should never be just something that happens to your family. If something doesn't feel right, you as a parent, you're allowed to say no. If it feels like a bad fit, you're allowed to say no. If this isn't about what's best overall, it's about what's best for you, your family, your child. ABA it's just a tool. And like any tool, it can be used well and it can be used poorly. So it's on parents. Ask questions, trust your gut. And remember, you don't have to figure it all out right now. You're still sorting through the pros and cons of ABA. If you're reading this blog, it lays out everything clearly and honestly. There are pros, there are also cons. So just give it a read so you can move forward with confidence. You're not behind, you're not doing things wrong. If you're here, you're figuring out what's best for your family. And that's exactly where you're supposed to be right now. So check out the rest of the post, and I hope it helps.